Yeah,
He looks mean.
and he's about twice your age.
I wonder how they managed to get around.
I don't think we
It's
have
gotta
any
be
big
pretty
ones like
hard,
that.
Yeah, we don't have tortoises in Minnesota. So, all right. So what I want to do is I just want to take these off and see what's going on in here. Is this lamb's wool?
That's good.
Yes.
Okay. Do you want to hold on to that then?
No.
No. Okay. So you're using that because this toe is rubbing against the nail
Yes.
from here.
And,
Okay.
and the nail is gone,
The
basically.
nail is, yep, a lot of it is gone, but this, you still have all of this right here. So we'll trim that and thin it out for you.
Pruned it,
And we'll trim, there's a little callus in here too that we can trim, so. We'll start over on that side, on your left foot. And, yeah, so if we can get you back on a regular basis, I think we started out trying to do that several years ago.
Well, there are many
Joyce
other
does it.
appointments. and
Right,
things that
right,
were
yeah, I got it,
In between.
yeah.
See, I was always hesitant to do that clipping because I usually drew blood.
Mm-hmm.
And I thought, well. I don't
Yeah,
know if
and
that's
occasionally
good.
I draw blood too, but it's way easier to do it from down here than it is from up there.
Yes, right.
So that's why if you just turn this over to me and I see you every 2 or 3 months, then it's one thing you don't have to worry about anymore,
Mm-hmm.
okay?
Well, I'm glad it's being done.
Hmm?
I'm happy it's being
Oh.
done.
Yeah, it'll feel a lot better, I think.
That bothered me a lot, you know.
Yeah, I can see why. You mean it on Friday nights when you went dancing, they hurt in your shoes?
Mm-hmm.
It kind of eliminated the dancing.
Well, go make your plans for this weekend, because, I'm just kidding.
It's amazing how you can do that without drawing blood. Boy, I can't do hardly anything.
Yeah, I told you, even the best of us sometimes do draw blood, but, yeah.
Oh, boy. That's an art.
All right, now we get to the good one.
The big one, yeah.
So this will crumble and come off in pieces, I think.
Well, that's tough stuff, isn't it?
Mm-hmm. Well, yes and no. I mean, it's thick, but it just
It's
kind of
layers.
crumbles.
It looks like it's layers.
Yep.
The layers. Boy, I couldn't do that.
Nor should you.
I couldn't. See the blood flowing, the blood would be flowing. I think, I don't know, but it seemed to me that feet would be the most neglected part of the body, you know, as far as care.
You know, I think, you know, how do we quantify that? I don't know. Is it the most?
They're hard to get at, you know, they're hard to,
Yep.
and then it seems like every time I did it, I drew blood.
Yeah.
And then she got all excited because she doesn't like the sight of blood.
So she ran out of the
I told
house
you.
and left you
I
to deal
told
with
you
it.
that was gonna happen.
No, I went for the Band-Aids.
Yeah, she was run for the bandit.
Well, the good news is I don't know anybody who's ever bled to death from a toe.
But there's an art to that. I don't know why you could do that without, you know, that's pretty close work. And I would think that skin under the nail was pretty tender, was it not?
Well, you'll see that once, this nail, what I'm taking off, hasn't been attached for quite a while. And so the skin underneath is just kind of toughened up.
Oh,
It's
okay.
not sensitive. I'll show you that in a minute.
oh,
So I'm not taking off anything that's still attached to the skin. That would hurt, yes.
That's an art.
Mm. Yes.
She can't stand and watch it. You.
I can't see it.
They're good thing.
She can hear it, though.
Every time I get the clip out, she says, oh no.
Well, you don't have to do it anymore.
No. And they can read it too long. She was with you, a couple of years ago, right?
Yeah, you both were on my,
Yeah.
you both were in my computer. And,
She was very happy with the results, so.
well, good, I'm glad. All right, let's do the other foot. Now, you let me know if any of this is hurting.
He took a beating a lifetime,
They do,
you know.
they do.
Especially I often think about like an athlete, a football player. They
How
must
about a
have-
marathon
They
runner?
must have problems with it. Take a beating.
Yeah, there was about a 2-year period that I was treating a lot of our NFL players for a while. It was a referral source that sort of dried up, but it was fun while I did it, and they sure do take a beating.
I bet all these big professional athletic teams have all their foot doctors, because their feet must take a beating.
You know, I think in our city, most of them don't have podiatry,
They
team
don't.
podiatrists. They have foot and ankle orthopedists, I know. But,
Boy, you think that would.
you would
number
think,
one
but
problem.
then word gets around and one guy comes and likes what we're doing and tells his friends, and so.
If I get in there in 5 minutes, I'm drawing blood already.
Well, I can if you'd like me to.
Pardon?
I said I can if you'd like me to.
No,
Just make
no,
it feel
I
normal.
don't.
Okay, how do you keep the toes from going over each other?
You don't. I mean, you just manage them, doing exactly what you were doing with some padding.
Is it because the shoes aren't
No.
proper, or?
Nope, it's because you lived long enough with your foot type for the muscles to start pulling the toes over like that. If you lived long enough and you were walking, it was going to catch up to you. So, so what we do is maybe I have some better pads than the lamb's wool that you could use. But basically, you're doing what needs to be done, you know, especially because of your heart issues. You would not be a good candidate for us to go in and fix them.
Oh,
And how old are you?
Pardon?
How old are you?
86.
86, okay. Yeah, so you've got your age and your heart condition kind of working against you, so
Yeah,
You know, you can fix anything with surgery. Well, that's not true either. But you're not a good patient for us to want to talk about surgery.
No.
So what we do is we just kind of manage it and keep it from hurting.
Mm-hmm. So I think I waited too long.
I'm sorry? What?
I waited too long
Oh,
for the time.
you mean to fix your toes?
No, Joyce, yeah. You had that done, right? When you came? You were here a couple of years ago.
Mhm. But you had a few surgeries in between there too, so.
Yeah.
And then bacterial, that you had to go to St. Teresa's transition. The bacterial infection. in
Oh,
your
you
knee.
develop an infection in your knee?
Yeah.
Yeah.
And that was how many months?
Yeah.
In rehab, yeah. All right. So this is just gonna smooth everything out. You'll feel a little vibration. See, I did make you bleed a little bit. Okay, so you see how that skin right here, it's not sensitive at all? You know what, hang on a second, I can't hear you over this. Hold that thought. Alright. You have such a soft, gentle voice, I couldn't hear you. What did you say?
Yeah.
Were you asking me something?
No.
Oh,
You?
I was trying to remember what you had asked. Oh, when you get home, what are some of the important things to do with your feet, I suppose?
oh. Well, just make sure that when you shower, you dry really well in between your toes. Get out all that good toe jam and stuff. Keep them clean and dry. And then we will look at a couple different pads that you can use in here
Okay.
so that this stops rubbing on your toe. In fact, you do have a little bit of an open sore on this toe where the nail's been rubbing.
Yeah.
So we'll look at a better way to pad that. And then just make sure that you don't go too long in between visits again.
We do what?
That you don't go too long in between
Oh,
visits,
yeah,
okay?
So-
We start people at about 2.5 months,
Yeah.
and then we can adjust it longer or shorter
Okay.
based on how you do, okay?
Now, what do I do for that 2.5 months? Just
Nothing,
let it go, huh?
just leave it go, keep the right big toe and second toe separated from each other with a pad,
Okay.
and just keep in between the toes really dry. That's your homework.
So like we did, separating it the way we did, is just put things over them.
Right, but I'm gonna show you a little bit different pad.
Oh, okay.
Now, this is a little problem here. Where this little callus was,
Mm-hmm.
you have an open sore here. So we're gonna have to do a little bit more care and see you a little bit sooner.
Okay.
Because that,
Is
where,
that the toenail was rubbing on there?
maybe, would have been like that.
Yeah.
So maybe, yep. But, yeah, so there's an open sore, there's no infection there. Can you see that?
Mm-hmm.
The open
Yeah.
sore? Okay. There's no infection, but we'll cover it with a little bandage and we'll talk about what to do at home. So on this toe, you have like a sore here where it was rubbing on the nail.
Mm-hmm.
And then down here is a callus. So we're gonna do the same thing here that we're gonna do on your left foot in terms of treating it. So let me just trim this callus.
Okay. Oh,
Oh, look at that. So that's also an open sore, you see that?
yeah,
All that crud coming out?
yeah.
So this evidently is also an open sore.
They take a beating, don't they?
They do,
Feet.
yeah.
That's what happens when you're athletes, when they can walk after they're done with their careers.
Alright, so this one's an even bigger open sore than the other one.
Mm-hmm.
So we're gonna have to, what we're gonna do is we're gonna put a little antibiotic cream on that with a Band-Aid.
Okay,
Now, is your lovely bride gonna have to help you with that?
I can feel that.
Are you gonna be the one doing it? Okay. So, let me show you what you're gonna need to do. I'm gonna give you a prescription for, some antibiotic cream. It'll come in a tube like that. And what you'll do is on each of these 2 spots, you just put a little bit of the cream and then cover it, and do that once a day. And here on this one, you see where that sore is? Okay. So you'll put a little cream here, and then this is kind of a sore also.
Is it the best time to, what's the best time to do it?
Doesn't matter.
During the day? It
Doesn't really
matter.
matter, yeah.
Morning, night, doesn't matter.
Doesn't matter. But just once a day, maybe after you bathe or shower. Then just take a Band-Aid and cover it so the cream stays on both of them.
For how long would you do that?
Well, I'm gonna see you back here in a couple weeks,
Okay,
all right? If they start to get red or painful, or if the drainage starts to get stinky, I want you on the phone to me right away, okay? But then we're gonna see you back in a couple weeks, make sure these are healing up okay.
did I wait too long?
Well, that's a tricky question.
Mhm.
You know, yes, in that the calluses became open sores, but we're fine. We got you here now. You're not going to lose a toe.
Right.
You're not going to lose your foot. So, thank you.